All right, welcome to today's virtual office hours. I'm Becky Sanders. I'm the program director for the Upper Midwest Telehealth Resource Center. We cover the 4 states of Illinois, Indiana, Michigan, and Ohio. And today, in conjunction with the Ohio State Office of Rural Health, we are presenting Marketing Your Telehealth Program. So let me go ahead and share my screen and we'll get started. Now today is what we call virtual office hours, and we try and make those just a little bit more interactive, and it's only going to last about 30 minutes. So I will share some information via PowerPoint slides. Feel free to stop me. You can ask questions in the chat, or you can unmute yourself and ask questions as well. So here's a kind of a little idea for what the agenda is going to look like today. I'm going to talk first about change management theories and how we deal with change and kind of the culture of telehealth as we look at developing a telehealth program and then marketing it. As far as that developing of the telemedicine program, I'm going to talk about 3 large portions of that. So assessing and defining what type of program that you want to institute, or what type of services you want to offer or incorporate into your telehealth program, and then talking about developing and planning that program. Part of that's the business plan, the other part is the marketing plan, and that's really where we're going to spend the majority of our time today. But as it's part of this whole plan, I felt like it wouldn't do the topic of marketing justice without talking about the other things that are part of that plan overall. And the third part of a plan is the implementation and monitoring. So we'll talk a little bit about that and tracking outcomes and patient volumes and utilization, and lastly, celebrating the wins. Sometimes we work so hard on a program, but we forget to pat ourselves on the back or to tell our teammates, hey, good job. And how do we show our teammates that they've done a good job and show our appreciation? So this book I read in the late 1990s. It's by Spencer Johnson, and it's called Who Moved My Cheese? So the story revolves around 4 mice. So the cheese is moved around a maze, and the cheese, obviously mice like cheese and they want to get to the cheese, but the cheese keeps getting moved on them. So the change is forced upon them, and it's all about how they react to that change. And so there's 4 characters: hem, haw, sniff, and scurry. And you can see on the slide, they each have different personality traits. And I encourage you to think about the people on your own team in your work environment. Who in your work environment is Sniff, the innovator that loves technology, has what I call shiny-itis, always wants to start to play with the new technology, but is a very results oriented and a long view. We need to invest in this technology because in 5 years it's going to do what for us, as opposed to Scurry, the producer, who likes a real fast pace and a very short view. They're in it for, what are we going to do right now, tomorrow, today, tomorrow, next month, not 3 or 5 years down the line. And then we also have him, our stabilizer, liking a very structured, a slower paced approach. And then Haw, our unifier, that likes a very unstructured approach, is very laid back, but very process oriented. So it takes personalities of all types in our workplace to form a team. And you have, as we talk about the work plan, and that's how we're going to get things done, you need to assign your roles and responsibilities appropriately to people that have the right personality as well as the right skill set and knowledge. You wouldn't ask I'm trying to think of a good example. You wouldn't necessarily ask a nurse to pick out the IT equipment. They might be a really good technical person, but probably somebody from procurement or from the IT department would be best suited to purchase the IT equipment, or at least make recommendations to the team about what type of IT equipment should be purchased. All right, so let's talk about developing this telemedicine program that we want to market. So I'm going to go over some of these points very quickly because I want to get to the marketing and the meat of what we're going to talk about today. So when you develop a telemedicine program, the first step is to assess and define what kind of program or services that you want to offer, develop and plan how you're going to do that, and then implement and monitor. And another way of talking about change is the Plan, Do, Check, Act. It's another way of thinking about change and implementing change, but always, the implement and monitor, or checking your results, seeing if you've missed something, if something happened that you didn't even anticipate, and little tweaks to your program, and then going ahead and acting again on that program. So when we talk about assessing and defining our program, we need to know what type of services we're going to offer, and we won't know that until we take a look at our market and our environment. There is something called a telehealth champion, and we here at the Upper Midwest Telehealth Resource Center, we always recommend that you identify a champion within your organization. Now, this has got to be somebody who's a little bit of a visionary, but has the permission and the time from either CEO or your executive director, from management, to really run with this. Because being the manager over a telemedicine program takes a lot of time. There's lots of little pieces within it, and they really have to have the time to invest in it, to make them. Sorry, I got muted. The I'm not sure when I got muted. So anyway, you need to have a telehealth champion for your program, and that needs to be someone who has the time and the energy to devote to the program. And there also has to be a corporate willingness. If you don't have the executive team on board, your program is never going to be successful. And then, so look at what healthcare services are not available in your area. And that can be done using a community health needs assessment, but you need to be able to identify and prioritize appropriate telehealth services. For today's session, I'm going to use telepsychiatry as our example, because that all you need for telepsychiatry is stable internet broadband access, a HIPAA compliant telehealth platform, and the webcams and devices to make it happen. And you need to be able to also identify the program assumptions and constraints. If you are developing a telepsych program and you don't have any psychiatrists, maybe you need to work with a third-party vendor to get contracts in place for those. So without answering some of the paperwork, the credentialing, and the legalese up front, you might not have a successful telepsych program. So developing your plan, again, this is talking about figuring out exactly what type of services you're going to offer. Other services like telestroke or teleneurology, telecardiology, you're going to have certain equipment available in order to run the specific tests needed for that type of service. So if you start with something simple like telepsychiatry, it's easier to dip your toes into the water and then expand from there. So, but really what you need to answer in part of your development process and planning process is you need to know, where are your patients and what services are going to meet their needs? What technology do you need? And what's the best organizational model to start your program, to kick it off? Do you need to get human resources involved in hiring additional staff with the specific credentials or licensure that you need? Do you need any facility resources? Do you need a dedicated telehealth or telemedicine room at your office location where that provider is going to be during the visit, or where that patient might be during the visit? So who's going to provide that service? Do you have someone on staff? Do you need to recruit someone to provide this service? And then what about existing providers? If you don't have them, you're going to be looking at a third-party contract. And then any legal or regulatory constraints. So that provider needs to be licensed and credentialed at your facility, and people in HR might be taking care of that, or within the medical department might be taking care of that for you. And then what's your implementation approach? I really recommend a phased or a pilot approach where you start with patients that are acute patients, maybe that come into the emergency room at your hospital and they need a site consult, and maybe it's after hours. You know, what do? Do you make them wait 2 days till somebody comes back in the office, or do you have after hours consultation with a third-party vendor? So as you develop your business case, I've spoke already about the community health needs assessment, and the information that you can gain from a community health needs assessment should fit with your organizational mission and whatever you decide to do with that program. So you don't want to start a program that's not going to fit with your organizational mission and the need of your patients. To obtain the financial commitment for implementation and sustainability, you're going to need permission from the CFO of your organization or the finance person. You might have some startup costs that you might need approval to procure. You're going to need to identify your payer mix. What's your mix of patients that are Medicare or Medicaid or commercial or private pay? Because that is going to affect the sustainability of the project. And then many times telehealth programs are not get-rich schemes, rather they are cost savings programs, especially if your organization is part of an accountable care organization. So you're going to want to track savings. So these are data points that you're going to need to gather data both from your providers and from your patients. On scheduling, you know, many times providers would go out and do rural rotations, meaning they're from a large urban center medical location, and they would go out and visit rural locations and see patients from rural areas that had come to their urban facility, but only be there maybe once a month or once a week. So this, thinking about offering services virtually via telehealth, is going to allow that physician more time in their schedule because they won't be spending unproductive windshield time on the road. Also, you're going to want to track patient miles saved. You know, if they're going to go to a local facility or if they're going to stay at home, then what's the difference in what their time requirements are for the visit and their travel miles saved. And you can also drill down to if the patient needs additional labs, x-rays, MRI, CAT scan, all of these other things, then that revenue is kept in the local market where the patient stays for the visit. And then you can also track the carbon dioxide footprint for emissions for any mileage saved. So again, going back to hem, haw, sniff, and scurry, thinking about the people in your organization that are going to be part of your team, we need to think about our work plan objectives and identify who's going to be part of the team, what are their roles and responsibilities going to be, and who is going to be the team leader. We need to know the communication and the marketing strategy. You could have the very best program out there, but if no one knows about it, you're dead in the water. So think about what are your options for marketing. Local newspaper ads, do you have a local newspaper? TV commercials, do you have a local TV channel? Do you have a library where you could put up flyers? A YMCA, a business area in town, doctor's offices, retail establishments, stores, restaurants. You could do a direct mail campaign. And then there's always social media. So if you're using Facebook or Twitter or LinkedIn or Instagram or a variety of any of the other popular social media sites, think about those and how can you reach the patients that you know that are out there? How can you let them know? Do you start talking to patients when they come in and say, hey, for your next visit, would you like to try a telehealth appointment? And part of this is training your staff and making sure that you have updated your clinical reference guidelines and scheduling for your policies and procedures. So it's a very smooth um, process for the patients. And then also training for your staff. Every single person on your staff that is either helping to schedule a patient or helping to communicate with a patient to make sure that their technology is set up, that they have what they need, to the provider, to anybody that does even the billing and coding. It's important that they get trained on whatever platform you're going to use for your telehealth program, because if they're confident in it, it's going to show in how they deal with that patient. They're going to be able to answer patient questions. They're going to able to answer nurse or physician questions as they come up. And the more training they get before you actually start, the more comfortable they're going to be, and the easier they're going to be able to handle any issues with the technology. If the internet fails, if you need to you lose sound, you lose audio, all of these things can happen, and you always need to have backup plans. So doing that upfront training with your staff gets them comfortable with the video conferencing platform and helps them think through the process as well. The best thing out of it is the free marketing that your staff are going to do with their own family and friends and neighbors. So then thinking about the clinical space, if the patient is going to be physically at your site and the provider is at a distant site, you are going to need some type of patient room. You can think about that as just a normal clinical office space, which is fine as long as it meets your needs for the type of service being provided. Broadband is a huge part of this. And even now, when we talk about what happens if the patient's at home, they still need to have adequate broadband in their home. Things that you need to think about on the clinical side is, do you have appropriate broadband internet access? Check with your IT folks and make sure that they have support levels, either a 2 or 4 hour support level. So if there's a storm that comes through or construction that cuts a broadband internet line, what is your backup so that you have internet access and your patient sessions aren't dead in the water. Also thinking about your electronic medical record. Many of the larger electronic medical records have patient portals. You can use patient portals to help schedule appointments with your patients and also send them instructions on how to access the platform, how to test their broadband capabilities prior to their actual visit. And then organizational approval. Some of these things may require your CEO or executive director to approve them, for not only for procurement of equipment, but also authorization for additional personnel or staffing resources. So talking about the outcomes, we need to know, and this plays into our marketing plan. So what are our program goals, and what are our objectives, and what are our outcomes? As we start to market the program, this information can be used in our marketing. Hey world, we have a new telemedicine program that we're going to start to offer. Our goal is to provide access to telepsychiatry for individuals that have transportation issues. That's a good goal. One of our objectives as part of that goal is to decrease wait time to seeing a professional. And one of our outcomes might be to increase patient satisfaction scores. So all of those things you can use in your marketing. Internally, you're really going to be tracking your measures as far as volume and utilization. You're going to be tracking hopefully, decreased no-show rates, because patients won't have transportation issues if they're at home, so they'll show up for their appointments. So you're going to track that. You're going to track efficiencies, and all of that data internally is going to help you to know whether or not you have met your goals or exceeded your goals. So part of these outcomes in this impact tracking is really your data collection methodology. Again, if you've got a patient portal, you could put polls in your patient portal. You could use external surveys. You could put links to surveys at the end of the patient session, and look at the quality and clinical outlines, just as if the patient was there in person with the provider. Those same surveys that you send out can be used, and you can ask if the patient had a good telemedicine visit. If they hadn't had the opportunity to be seen virtually, what would they have done? Would they have sought help elsewhere? Would they have not sought help at all? All of these things play into data points that you can use for future marketing. And then as we really talk about the improvements, how you're going to improve efficiencies in your program, you want to define and plan, implement, test, and manage all of your program improvements. So all of that, it leads up to our sample work plan. And in order to have our sample work plan, we have to know what we want. In this case, I told you we're going to try and reduce wait time for site consults in the emergency department. Our strategy and objective is how we're going to get there. And so what we want to do is start by providing telepsych services in the emergency department. So what are the steps to get there? We have to have a place for the patient, a place for the provider. The provider, in this case, will be off-site. The patient will be in a room close to the emergency department. We are going to have to invest in some video conferencing technology. We might have firewall issues. We might need to run a hard internet line into the room because of all of the equipment that's in the emergency department might interfere with the Wi-Fi. And we have to hire a psychiatrist if we don't have one available. So who is going to do that? That's who's going to be on our team. We need a team lead, and for this sample, I've got 2 people on the team that are going to help that team lead. So our team lead is probably going to be our telehealth champion. Team member A is going to probably be an IT person because they're going to figure out what's the best telehealth platform to use. Team member B is going to be in charge of getting us the provider that we need, in this case, a psychiatrist, either someone from the local area or a third-party contract vendor. It varies. How long will it take? So when the pandemic started in March of 2020, overnight, so many organizations had to kind of flip a switch and figure it out overnight how to best take care of their patients. Now we've got a little bit of time. So I said by the 4th quarter of 2021, we're almost into July, so that gives us July, August, and September to get everything into place. And then we're going to start in October. And then our outcomes, so we want to be able to see 24 patients by the end of the year, by the end of 2021. So that gives us 3 months, October, November, and December. I put 24, so that's an average of 8 patients per month, an average of 2 patients per week that we're going to see via this new technology. That's the only way we're going to know if we've achieved our goal, is we have to set our baseline. What's it, track it right now for in 3rd quarter 2021 while we're doing all of our planning, so that we can take those 3rd quarter 2021 patient volumes and then compare them to the 4th quarter patient volumes, and we'll measure that change. Now, one thing, if you've not heard of it before, is this acronym called SMART. And SMART stands for specific, measurable, achievable, relevant, and timely. All of your goals and objectives and your outcomes need to meet this guideline. When I make my own work plans, I always put my goals as very achievable. I would rather overachieve on my goals than not achieve them at all. I believe the answer is yes. We've got a question in the chat. In Ohio, can the clinical telehealth space be the practitioner's home if you're doing telepsych? In general, I know that the patient can still be at home. Ohio just, if I think it was effective last Friday, did rescind their public health emergency or sunset their public health emergency. And Ohio made the patient's home an eligible site back in 2019, way before the pandemic. I do not believe that there are any restrictions for telepsych in particular over any other. For the person that asked me that question, if you would, my email will be on the end of this, or you can contact Carolyn, who did the registration for everything today, and let me know, and I will get that document to you for the state of Ohio and their Medicaid program. We can send it out to the everyone who's registered if you guys would like. Just let us know. All right, so implementing and monitoring your program. And here is where you're going to stop, and still your project team should be meeting on a weekly basis or a monthly basis. And you should be monitoring what's good, what's bad, what can we change, what can we tweak, what happened that we didn't even think about. But really celebrate those wins. The top 3 things from any employee is going to say that they would like, and as far as being appreciated by their employer: food, money, and time off. So let's think about those just a little bit. So food, your team has a big win. Maybe you throw a pizza party for lunch. Maybe you bring in bagels for breakfast. You bring in extra snacks during the day. Money, there's a lot of different things that you can do that don't really cost a lot of money. You could do instant recognition awards. I worked once in a place where if a manager saw one of their employees doing a great job, they could submit for an instant recognition award, and they got, I don't know, $50 or something like that. But you could do $5 gift cards to the local coffee shop or the cafeteria in the hospital. It doesn't have to be good, a huge amount of money. Paid time off. Does your organization offer comp time, or can you give them an extra vacation day for a job well done? And then some no-cost recognition, call outs in an internal newsletter, little highlights, articles on the employee and what they did for social media, a certificate signed by your executive director or your CEO of the organization. There's so many ways that you can appreciate your team and their hard work. The limit is your imagination. So really all of this goes back to that plan, do, check, act. And in the marketing of your program, you really need to have a good plan. And as you implement it, you always need to check back and see what went well. How are you achieving your goals? Are you achieving your volume utilization that you're targeting? And if not, what can you tweak? Do you need to run another marketing ad? Do you need to do another push, in a newspaper, in a newsletter, in social media, through direct mail? There's all types of ways that you can reach your patients. And one of the best ways is word of mouth from other patients. So as you have patients that start to use the program, give them those surveys, give them the opportunity to submit a testimonial that can be used in future marketing. And we can reward patients too. We can reward patients with stickers, with candy at the checkout. We could reward them with a $5 gift card, or they complete the survey, they get free lunch in the cafeteria. Again, endless ways to recognize those that are blazing the trail for us. I'm going to leave you with this quote here. This is also from Who Moved My Cheese by Spencer Johnson. So the handwriting on the wall: change happens. They keep moving the cheese. Anticipate the change. Get ready for the cheese to move. Monitor change. Smell the cheese often so that you know when it's getting old. Adapt to change quickly. The quicker you let go of the old cheese, the sooner you can enjoy the new cheese. Change. Move with the cheese. Enjoy the change, savor the adventure, and enjoy the taste of the new cheese. But be ready to move again quickly because they will keep moving the cheese. So there's my contact information. We've got just a couple minutes. We can ask some questions, and you can also follow up with Carolyn or I via email. Carolyn has got the link. She's going to go ahead and put it in the chat for our survey. We are federally funded with the work that we do, and sponsored by the Ohio State Office of Rural Health for today's virtual office hours, and would like to report any success stories, if how this session has helped you, what else we could do in future sessions. We'd like to report that both to the State Office of Rural Health in Ohio and to HRSA, our other funder. At this point, I'm going to stop sharing and open things up for questions. All right, well, hearing no questions, we will go ahead and end the session for today. Thank you for joining us and have a great rest of your day.